Hello, my name is Yegappan Kalairajah. I'm one of the specialist orthopaedic knee surgeons at Hatfield Hospital. The knee is a complex joint with many components, making it vulnerable to a variety of sporting injuries. The most common knee injuries include fractures around the knee, dislocation, and sprains and tears of soft tissues like ligaments. In many cases, injuries involve more than one structure in the knee. Pain and swelling are the most common signs of knee injury. In addition, your knee may catch or lock up. Many knee injuries cause instability, the feeling that your knee is going to give way. If you hear your knee pop and then give out at the time of impact, it's definitely a cause of concern. This popping sound could be the sound of something tearing. The commonest injuries that need treatment from an orthopaedic surgeon are fractures, ligament tears, especially the anterior cruciate ligament, meniscal tears, and kneecap dislocations. However, every knee injury needs to be treated appropriately to prevent ongoing issues. It is important to rest it subjectively, but do some gentle movements within the limits of pain. Ice the knee, elevate it, and apply some compression. This is also known as the rice treatment. If the knee swells up very rapidly after injury, if there's weakness or instability, clicking or crunching, or difficulty straightening, I would recommend a prompt visit to your local A&E department to exclude anything that needs urgent treatment, such as a fracture. The others will need medical attention if it doesn't start settling within a few days of rice. Knee injuries can occur in all sports, but it is more common in sports such as football, accounting for nearly half of all presenting knee injuries in some studies. In football, the commonest injury needing intervention is rupture to the anterior cruciate ligament. In other sports such as running, meniscal tears seem to be more common. For fractures around the knee, immobilization with a plaster or brace may be necessary to allow the fracture to heal. But if it is displaced, this needs surgical intervention to improve the position and to fix this. The meniscus, if torn and causing mechanical locking or catching issues in younger patients, would certainly benefit greatly from keyhole surgery to tidy up the tear or repair it if possible. With regards to the anterior cruciate ligament injuries, some can be managed non-operatively with physiotherapy and occasional modification of activities. Others will require reconstruction. Unfortunately, direct repair to the ligament is not usually successful with ACL tears, and alternative grafts such as your hamstring tendons are used to reconstruct the torn ligament. Anterior cruciate ligament surgery, the patient usually goes home the same or the next day and uses a crutch to move around for up to 6 weeks. I would recommend avoiding driving for 6 weeks, and it is important to rest, elevate, ice the knee in the first few weeks. I would anticipate the majority of patients, once having built up their muscles, to return to an active and near normal lifestyle. As with all surgery, problems can sometimes occur with ACL reconstructions. Like any surgical procedure, there's an incidence of infection that can occur, bleeding, nerve and vessel injury, or a clot in the leg can form. These are called deep vein thrombosis, which can on occasions break off and go to the lungs, which can be life-threatening in the rarer instances. The knee itself can be stiff in some individuals, and the graft can stretch or re-tear. Thankfully, we have minimized a lot of these complications with techniques and prophylactic measures and good physiotherapy, but unfortunately, we cannot eliminate them. If you're an NHS patient, you need to see your GP to be referred on. Usually this is then assessed by the musculoskeletal team to ensure all conservative treatment strategies have been tried before being referred on to an orthopaedic surgeon such as myself. As an insured private patient, you need to get a formal referral from your GP to ensure insurance cover, and then you can either contact the hospitals that I practice at to make an appointment or ring my secretaries. If you are self-paying, you can do this without having to see your GP, although it will always be best practice to keep your GP informed.